Aloha, everyone. Good afternoon. Thank you so much for joining us today in this special Hawaii Public Health Training Hui webinar titled Environmental Health Concerns of the Maui Wildfires, presented by Catherine Perkle and Rosanna Weldon of the Office of Public Health Studies at the University of Hawaii at Manoa. Before we get started, just kind of want to go over some Zoom housekeeping for you folks. First of all participants are muted upon entry. For any questions that you have for the presenters, please utilize the chat or the Q&A boxes located at the bottom of your screen. I'll be monitoring those throughout the presentation. And this meeting is being recorded on the Hawaii and will be shared on the Hawaii Public Health Training Hui's YouTube channel shortly after. So sponsors for today, we want to thank Ola Hawaii, the Western Region Public Health Training Center, as well as HRSA, Health Resources and Service Administration, for providing the funding to put something like this together. So continuing education is provided just for today. We have been approved from ADAD to provide CEs for substance abuse counselors and certified prevention specialists. For anyone that's on the call today that just need a certificate of attendance, please make sure to email me following these instructions, and then I will make sure to send those to you folks following. Like I said, register and attend for today's training to get CEs. I will email out the evaluations to you folks in a Mahalo email shortly after this. Certificates of attendance will be mailed out by next week, Friday. And for those that are calling in seeking CEs, please email myself at makamai@hi-fi, so MAKAMAE @hiphi.org. So I just want to introduce you folks to the speakers today. Let me, okay. So our first speaker, Dr. Perkle, is an associate professor in the Office of Public Health Studies at the University of Hawaii at Manoa. She is trained in life course and environmental epidemiology. Her research focuses on women's health across the lifespan, in which she examines at how experiences during childhood and adolescence, such as exposures to environmental contaminants, food insecurity, and poor quality of care, contribute to the development of chronic diseases and disability. She has collaborated with multiple state, provincial, and federal agencies to provide technical assistance on the interpretation of environmental contaminant concentration in marine environments and how to communicate these values to the public. She has collaborated with teams in the Republic of the Marshall Islands, the Canadian Arctic, Bermuda, Brazil, Burkina Faso, Mali, the Republic of the Philippines, Senegal, and South Africa. Our next speaker, Dr. Weldon, is an associate specialist faculty member in the Office of Public Health Studies at the University of Hawaii at Manoa. She received her PhD in Environmental Health Sciences from the University of California, Berkeley School of Public Health in 2010. Her research interests and expertise are in exposure assessment and environmental epidemiology, with particular focus on women, children, and reproduction. During her career in public health, she has worked on various large-scale, federally funded studies, including a 20-year longitudinal birth cohort study of primarily Mexican-American women and children exposed to pesticides in the Salinas Valley, a Superfund study of the associations of nutrients in semen and genetic endpoints measured in the sperm of healthy men, an occupational health study of the genetic effects of benzene measured in both semen and blood of Chinese men, and a study of gene-environmental interactions in patients with lupus or multiple sclerosis. Her recent work at the University of Hawaii has included a project with the Department of Health to examine statewide health inequities, as well as a needs assessment project with DOE to equitably address student health needs in Hawaii's public schools so that students have the best chance at academic success. She has also been working with Hawaii Alliance for Progressive Action to determine potential health effects of pesticides in agricultural communities across Hawaii. These projects have facilitated conversations and fostered partnerships with government and community-based entities to help her gain an understanding of the unique aspects of public health research in Hawaii. So without further ado, I'd like to hand it over to our speakers.
Aloha, just give us a second to be able to share the screen.
Sorry that I had a bit of a problem.
think we're just troubleshooting. Give us just a second.
Okay,
Oh, okay.
sorry about that.
Thank you for doing this. All right, we'll start from the beginning. Thank you, everybody, for your patience. So my name is Catherine Perkle. As mentioned, I'm in the Office of Public Health Studies, and this is my colleague.
Hi, I'm Rosanna Weldon. Most people call me Sonny.
And so I think we want to just start off by saying how much we appreciate, first of all, the Hawaii Institute for Public Health for organizing this presentation. And of course, for all of you who are attending. It's hard to really understate how heartbreaking the consequences of the Maui wildfires have been for all of us in this state. What we hope to do in this presentation is to help address some of the questions that are out there about some of the environmental health concerns of the wildfires, especially those related to toxic compounds. I think many of us are well aware that the media has given a lot of attention to toxicity and potential toxic compounds as a result of these fires, and it's hard to navigate all of this information. While this presentation is not comprehensive, we hope that the information in it will help to answer some of the questions that might be out there regarding toxicity. Now, I do want to put out some important caveats. This is a very dynamic situation. A lot of the information is not yet available in terms of some of the samples that are being taken. And so what we're going to do in this presentation is we're going to present results from research that's been largely conducted elsewhere. So some of the things that you will see certainly can be generalized to the fires that we've just experienced, but there may be things that are very different. So we might see that some concerns that were raised elsewhere are not concerns for us. In other cases, some concerns may become even more prominent, and we may discover new concerns overall. So once again, it's just a reminder that this is a dynamic situation. Okay, next slide, please. So in this presentation, we have a handful of learning objectives. We hope that by the end of it, you will be able to understand different routes of exposure to contaminants from wildfires, that you'll have an idea of some of the most vulnerable populations to the adverse health effects of wildfires. You'll be able to identify or name at least one or two chemical or metal contaminants of concern, that you'll have some idea of the potential health effects associated with various contaminants that may result from wildfires. And then at the end, we will provide some tips for reducing exposure. Next. So the organization of this presentation is as follows. We'll begin with some wildfire basics. We'll talk about some general public health concerns associated with wildfires. And then we're going to go specifically into 3 types of exposures to wildfire contaminants. We're going to start with smoke. We'll talk about ash, and then we'll end on water contamination. And then the end of this presentation, we'll be talking about ways to reduce exposure to potential contaminants. So we're going to start first with some fundamentals. Next slide. So the first thing I wanted to highlight before we even started to talk about wildfires has to do with language. We hear, when we talk about this, and I'll use this word throughout, I say wildfires, but the term wild has a connotation of something happening in nature, of it being non-human. And same thing, you'll see this is a number of articles have talked about this being a natural disaster. And again, this has it gives the idea that this is something that, again, is divorced from us as humans. It's happened in nature. It is inevitable, and we therefore have limited responsibility for these events. I'd like to question that a little bit and say that, these events, we have done a lot as humans to create the conditions in which wildfires are more likely to happen. So I just really want to highlight before we go into this, that these are things in which people can have a role or an influence. Next slide. So we have a lot of tools out there that help us to identify, for example, areas that might be more at risk for wildfires. This map shows a variety of places that are at higher risk than usual or above normal risk for wildfires. So this is for August 2023. And you can see, for example, Hawaii is in red, suggesting that we have an above average risk for wildfires. Next slide. So what is a wildfire? Well, wildfires refer to the uncontrolled fire that burns wildland vegetation. So this could be forests, grasslands, savannas, and other ecosystems. And there's different types of wildfires. There's ground fires, surface fires, and crown fires. The Maui wildfires were essentially surface fires. These are fires that burned dry or dead vegetation on the ground. And there are a number of factors that can increase the likelihood and the intensity of wildfires. These include wind, high temperature, and dry fuels. Next slide. So I'm going to bring up this slide and it'll come up, or at least parts of the slide will come up throughout the presentation. I want to highlight that the human health effects or the human health risks associated with fires actually depend on a lot of factors that are unique to that fire itself. So it will depend on the type of fire that happened, the amount of fuel that was burnt, how hot the fire burnt, how long it burnt, what were the weather conditions, and the amount and type of materials burnt. In particular, throughout this presentation, we're going to talk a lot about the types of materials that burnt, because it's these types of materials that have an influence in particular on the potential toxic concerns associated with these wildfires. Next slide, please. So fires are becoming more common and destructive across the United States and globally, actually. The annual area burned by wildfires is increasing. We see more fires, bigger fires, and a longer fire season. Warmer temperatures, reduced snowpack, and less warm season precipitation are all creating conditions in which wildfires are more likely to occur. And of course, climate change is amplifying these trends. So you do not have to memorize this figure. It's a useful figure from what is actually a very good article that I encourage you to explore if you want to learn anything more. And this is an article that came out in the New England Journal of Medicine, Wildfires, Global Climate Change and Human Health. And what they do show in this figure is basically what is a vicious cycle in which wildfires can contribute to climate change and climate change can contribute to the likelihood of wildfires. But what's really important to retain here is that climate change is contributing to changes in rainfall, strong winds, and higher temperatures. And all of these things create conditions in which wildfires are more likely to occur. Next slide. So what's happening here in that one of the things that I think is critical when we think about the Maui wildfires is this idea of the wildland-urban interface. So you'll hear, especially on government websites, a discussion about this thing that's called, as I said, wildland-urban interface. And this is essentially the intersection between wildlands or wildland vegetation and human development. So basically where wildlands and people intersect. In the United States, it's estimated that there are over 60,000 communities that are right at that interface, and approximately 3,000 structures a year are destroyed from fires at that wildland-urban interface. And this interface is growing by about 2 million acres a year. What happened in Maui is essentially a fire that occurred at that wildland-urban interface. And there are very specific toxic concerns associated with fires that happen at this particular juncture. Next slide. The other thing I want to highlight is that there are linkages between wildfires and invasive species. So invasive plants, especially invasive grasses, can fuel wildfires. They can accelerate their speed and they can increase their severity. And once a fire has burnt an area, it can make it more likely that invasive species recolonize that area. It's been described in one source as being a blank canvas for invasive species to invade or reinvade. And this in turn recreates that cycle in which fires are more likely. I'm highlighting this because non-native grasses are believed to have contributed significantly to the Maui wildfires. Next slide. I also want to bring up one last thing, and that's about the precedent for hurricane-associated fires in Hawaii. I think in the news, we've heard a lot of people say, well, this was unprecedented. Who would have ever thought that there could have been a fire associated with a hurricane? And the reality is we actually do have precedent for wildfires being associated with hurricanes in Hawaii. Hurricane Lane in 2018 contributed to fires both on Oahu and in West Maui. In fact, there were 3 fires associated with Hurricane Lane in West Maui, including one near Lahaina that got very close to urban structures. We also know that West Maui is particularly vulnerable to fire in a more general sense, and that it is possible for hurricanes to amplify that risk. So, as already mentioned, this is an area with non-native grasses and shrublands, largely on abandoned agricultural land. So that's the sort of wildland portion of things. And we also have, during certain weather conditions, certain meteorological conditions that can be associated with hurricanes, windy conditions that drive a storm, driven by a storm environment and the unique topography of West Maui, that create a situation in which wildfires are much more likely to occur. Next slide. So I'm going to pass it off to my colleague at this point.
So there are clearly many public health considerations associated with wildfires, and we're just going to touch on some of them. Wildfire is a public health crisis. Of course, there is the immediate injury from exposure to the heat or the flames, and those basic needs such as shelter and food needs to be addressed for those who are evacuated. In addition, there are barriers to healthcare when wildfires occur, and I cannot underscore the mental health implications of being affected by a wildfire. In addition, in Hawaii, historical trauma is present, and a wildfire can amplify this historical trauma experienced by those of Native Hawaiian descent. And especially because of the cultural importance of an area like Lahaina, this could be particularly prominent. I also wanted to mention that this sort of historical trauma can be multi-generational. And so there are epigenetic changes that can happen that can affect generations years from now. For this particular talk, we are going to focus on the environmental contamination, but I just wanted to address that there are so many other considerations and public health areas that need to be addressed when a wildfire breaks out. So this was a front page of news that human health risks linger in the air, in the water, and even in surviving buildings. This is clearly an environmental health disaster, a wildfire. And even Governor Green acknowledged that a lot of understanding needs to occur for those who are traveling into a zone where the fire occurred. There are health consequences, there are heavy metals, there are reasons to avoid the structures because they're dangerous, and there's already been too much life lost. So now I'm going to transition a little bit into a little bit more of the nuts and bolts of exposure. There are 4 real routes of exposure to humans. Those are typically inhalation, ingestion, dermal contact, and injection. For the wildfire context, injection really isn't as relevant. So I wanted to focus on inhalation of particles and gases, ingestion of contaminants from water or other non-dietary sources, or even sometimes dietary sources, and dermal uptake if you have direct contact with chemicals or ash. And some things to consider regarding exposure are that the dose makes the poison. So the duration of the exposure is important, as well as the concentration of the contaminant, and the physical properties of the chemicals themselves can all impact health effects. There are vulnerable populations that we wanted to address in their talk as well. Certainly those who have pre-existing conditions, or diseases, including pregnancy. The developing fetus is at risk. There are cardiac and pulmonary issues that can be exacerbated. There are certain occupations that are at risk of higher exposure, such as firefighters. And then there are other issues that affect vulnerability, such as access to publicly available information on risk mitigation and how emergency preparedness and early warning can affect outcomes. And there are also location of dwellings and roads and workplaces and critical infrastructure that all affect exposures and eventual vulnerability of a population. In particular, there are demographic considerations that affect vulnerability. Older adults and low-income communities are disproportionately affected by wildfires. If you look at the little orange arrows there, certain populations, in particular, white and Native American populations, those who are unemployed or at low income, or over age 65 or even lower educated tend to be more at risk. I wanted to also point out a 2021 study of the fire, or in 2021, the fire death rate for people over 65 years of age was 33.9 deaths per million people. And that the relative risk of dying in a fire for an older individual was 2.6 times higher than that of the general population. There are many reasons that the older population would have a hard time. They often have pre-existing conditions. They often have mobility issues that maybe would make it harder for them to evacuate, or at least evacuate quickly. There are increased hospitalizations and death rates from cardiovascular respiratory issues. And there are always worse outcomes for older women and older adults of color in particular. After the fire situation has been contained, there are also barriers to access to care and medications and staying connected with their caregivers. But I wanted to point out the importance of this older population. Older adults are often play important roles for supporting the local community and for supporting their family members and for providing just a network of support for the community to recover from a wildfire. So pregnant women and children are also more vulnerable. There is often maternal transfer of chemicals from the fetus, from the mother to the child, either in the fetal stage or also after the child is born through breast milk, for example. Children are different. They're not just little adults. Children go through rapid growth phases. They're developing. They have these, there could be these critical windows of exposure that affect children differently, depending on where they are in their development. Children also have different behaviors. They have hand-to-mouth behaviors. They put all kinds of objects in their mouths. They spend more time outdoors. They also eat, drink, and breathe more air per unit of body weight compared to adults. So they just have more potential for getting chemicals into their bodies. And then, of course, there are different life stages. At different life stages, there can be different health effects. For example, lead. If you're exposed when you are a child, you can have permanent neurological disabilities compared to when you're an adult. I also wanted to mention this issue of chemical mixtures. Often when studies and regulations are done or constructed, they focus on one chemical, one health effect, and they try to assess the association between one chemical, one health effect. Sometimes animal models are used. And the reality is, certainly in a wildfire, you are never exposed to just one chemical. You're always going to be exposed to a mixture, complex mixtures of a variety of chemicals, both in your daily life and over your lifetime. And there can be low dose chronic exposures, or there can be acute exposures in a wildfire situation. But one thing that's important to notice is that mixtures can have synergistic effects. So when you combine, for example, ozone and aldehydes, the resulting health effect can be amplified by having both exposures at the same time. And the reality is that this is a tricky problem to solve. There are experts in the world that are grappling with this issue at all times. It's difficult to take the right measurements, and expensive, by the way. It's difficult to determine cause and effect when you're exposed to a mixture of chemicals. And there are complicated statistical modeling that has to happen to try to account for the different mixtures.
Okay, so I'm going to move on to talking about smoke in the air and the potential environmental health concerns associated with smoke. Next slide, please. So here are some images you've probably already seen. You can see the fires that were happening at pretty much their peak stage in West Maui, as well as around Kula. And then the image here on your right shows extensive smoke in the air, and this was taken by the U.S. Coast Guard during search and rescue operations. So there are some immediate health risks associated with wildfire smoke. Eye irritation is highly common. And people can get corneal abrasions. So it is recommended that people who present at a healthcare site, if they're complaining about eye irritation, that they be screened for a corneal abrasion. There's also major concerns for people with existing chronic conditions, for example, asthma. And this can be particularly problematic when somebody's having to evacuate quickly, where they may not be able to get the rescue inhalers or access care in a timely manner. This is not just the case for asthma. This would apply to many chronic conditions. You can imagine what would happen if somebody had type 2 diabetes or somebody needs to get their cancer medications. And then reduce visibility. As you can see in this image, smoke can cause dramatic reductions in visibility, and you can have car crashes associated with smoke in the air. Next slide. So wildfire smoke impacts health through both gaseous and particulate pollutants. So we're going to go through these a little bit more specifically in the following slides, but basically want to highlight that particulate matter, ozone, and carbon monoxide are present in high quantities during wildfires. Typically, the carbon monoxide is more restricted to the areas directly affected by the fire, and ozone and particulate matter, however, can spread for hundreds of miles. All three of these are well-studied pollutants that have known human health impacts. But the smoke of wildfires also contain traces of other chemicals, including toxic metals, and even small quantities of some of these can threaten human and ecosystem health. Next slide, please. Okay, so what is particulate matter? Particulate matter is a complex mixture that may consist of both small and solid particles and fine liquid droplets. And it may include soil particles, sulfates, metals, and other organic chemicals. So when you hear particulate matter, I'm just going to explain, you'll oftentimes hear of it talked about as PM 2.5 and PM 10. So just so you understand what people are talking about, particulate matter that's labeled as PM 10 refers to something that is 10 microns or less in diameter. And these are also referred to as respiratory particles. If you look at the image on the right, it has a human hair, and it shows you how small those particles are with regard to what we would think is very small, the diameter of a human hair. So PM 10, they settle out in the trachea and the bronchi. And what happens is once they get into your lungs, or into your respiratory system, they'll kind of move out of the throat. So the cilia in your respiratory system will bring them up into your throat, and you'll either spit them out or swallow them. If they're PM 2.5 or smaller, they'll go much more deeper into your respiratory system. They'll reach the small airways. And in this case, the way that they get removed is through scavenger cells in your immune system. Next slide, please. So particulate matter is associated with all sorts of physiological effects, such as damage to the cells of the cells lining the respiratory tract, local inflammation, impairment of immune cells, blood clots due to inflammatory responses, even changes in heart rate and rhythm. Next. And particulate matter has been very well studied. So both in terms of particulate matter that is there due to regular air pollution as well as to wildfires. And it does increase as particulate matter in the air gets higher, it increases the risks of many health concerns, in particular respiratory problems. It can lead to reduced lung function and more hospitalizations as a result, increased need for asthma medication use and hospital visits, especially due to asthma attacks, even respiratory affections. It's also associated with cardiovascular disease and with all-cause mortality. Next slide. So not all particulate matter is the same. We have air pollution for many different reasons. Most particulate matter, especially in urban environments, is due to the burning of fossil fuels. So for example, the driving of your cars. Wildfire particulate matter is different. It tends to have smaller particle size. It has more what we call oxidative components, so things like polycyclic aromatic hydrocarbons, and more pro-inflammatory compounds like aldehydes. And we'll talk about the polycyclic aromatic hydrocarbons, also known as PAHs, and aldehydes a little bit later. There have been studies that indicate that PM 2.5 may be 10 times more harmful than other forms of PM 2.5 at equal doses. So it appears that wildfire particulate matter may be more harmful than other types of particulate matter. Next slide. So here's some information from a couple studies that look at specific harms related to particulate matter. So wildfires will increase the amount of particulate matter that's in the air. One example is if we were looking, was work that looked at the amount of particulate matter in the air during the 2020 California wildfire season. This was a really bad wildfire season. And in areas near the wildfires, they were seeing a daily mean particulate matter concentration of about 350 to 500 micrograms per cubic meter. The standard is 35. So this is far, far higher than what would be considered acceptable. We know from a variety of studies that each increase of 10 micrograms per cubic meter of daily particulate matter, PM 2.5, is associated with an increased risk of death. Interestingly, there was a study done in Australia. It looked at what bushfires from 1997 to 2004, and they saw a 5% increase in non-accidental mortality on days in which there was high wildfire air pollution. Next slide. We also see that particulate matter can increase the burden on our healthcare system. So again, looking at California, a study in California that looked at the 2004 to 2009 wildfire seasons, they saw that on days that had high particulate matter concentrations, that there was an increase in unscheduled hospital visits for all forms of respiratory diseases, and a very dramatic increase for asthma specifically, about a 10% increase. And what was notable was, again, this going back to this concept of vulnerable populations. The largest effect, the population that was most impacted, were children with asthma ages 0 to 5 years. They also saw an interaction between particulate matter and temperature. So days that had higher levels of particulate matter and higher temperatures were more likely to have higher hospitalization needs or visits as a result. Next slide. There have been less studied associations between wildfire particulate matter and health. So there's been a handful of studies that have looked at other things besides just asthma and general respiratory diseases. I want to highlight them here, but also be very, very clear that the evidence base or the amount of research on this topic is still very limited. So some studies have noted that wildfire particulate matter may increase the chances for low birth weight babies and for more preterm babies. It may also increase the rate of influenza, and they've seen associations with more ambulance dispatches for type 2 diabetes. But once again, I really do want to highlight that this is based on a very limited amount of literature. Next slide. So we've talked a lot about particulate matter, but there are many other things that are in smoke. So wildfires produce complex gaseous emissions that can be adsorbed onto particulate matter. Basically, they produce all sorts of things. They produce these gases. Sometimes you're just looking at the gases themselves, but also the gases can more or less bind with the particulate matter. That's less important than just highlighting what we do see out there. We see that carbon monoxide, nitrogen oxides, and other volatile organic compounds rise with wildfires. We also get increased ground level ozone, and we see emissions such as benzenes, PAHs, aldehydes, and volatile organic compounds associated with wildfire smoke. Next slide. So I'm going to talk specifically about ozone and carbon monoxide here. So most of us, when we think of ozone, we immediately think about what's going on in our atmosphere and that we don't want to have less ozone because ozone is critical for protecting us against the sun's UV radiation. As we have less ozone in the atmosphere, we're more likely to get skin cancer. But it really depends where the ozone is. So it's good when it's in the stratosphere. It is not good when it's at the ground level. So it's not good if it's in the air we breathe. So ozone in the air we breathe is associated with overall mortality and cardiovascular mortality. It affects the cells lining the respiratory tract and causes local inflammation. Common symptoms of exposure to high levels of ozone include coughing and sore, scratchy throat, and pain when taking deep breaths. It can also aggravate existing lung diseases like asthma and emphysema. And it takes about a lag of 1 to 5 days between the high air pollution measurement and many of the symptoms to become apparent. It's also of note, and this goes back to what was mentioned already, that we're talking about mixtures of things, and it's really hard necessarily to separate one from the other. So ozone and particulate matter, specifically PM 2.5, they appear to be worse when they're together. So they have what we call a synergistic effect. Next slide. Carbon monoxide is also increased when there's wildfire smoke. And this is particularly a concern for residents and wildfires in the immediate vicinity and during the wildfire events themselves. The primary route of exposure to carbon monoxide is inhalation or breathing. And carbon monoxide can impede the blood's ability to carry oxygen to body tissues and vital organs. Common symptoms include headache, nausea, rapid breathing, weakness, exhaustion, dizziness, and confusion. You can also have acute poisoning that results from resulting in hypoxia, excuse me. And this can have both reversible and lead to both reversible and irreversible neurological effects, as well as heart damage. We don't know a lot about chronic low-dose exposure to carbon monoxide, but it may affect memory, it may affect heart disease, it may affect birth weight. Next slide. Okay. So two other things that I want to discuss, because they are also very much associated with wildfire smoke, are aldehydes and PAHs. So aldehydes are carbonyl compounds found throughout the environment, and they're from both natural and anthropogenic sources. So a lot of plants have aldehydes. What we're really concerned here in particular are the anthropogenic sources. We, as people, we do a lot of things that create aldehydes, and sources can include automobile exhaust, combustion of fuel, cigarette smoke, power plant emissions, etc. Most people become exposed to anthropogenic aldehydes through inhalation. Common examples of anthropogenic aldehydes include formaldehyde, acetaldehyde, etc. So formaldehyde I'm highlighting specifically here because certain fires can produce it at very high levels in their smoke. A good example of this is smoke from the Indonesian fires in the early 2000s. And formaldehyde at low levels can cause eye, nose, and throat irritation. At higher levels, it can cause skin rashes, shortness of breath, wheezing, and changing in lung functions. And children or older adults tend to be more sensitive. Next slide. Okay. And then there's polycyclic aromatic hydrocarbons. We're actually going to come back to this a number of times throughout the presentation. So these are collectively referred to as PAHs. They're created and released into the environment when fossil fuels, garbage, or wood are burned. Major sources include the burning of meats, tobacco products, volcanoes, and forest fires, and they're found in plastics, roofing materials, and asphalt. So you can imagine in a place where you had a lot of burning of structures, garbage, wood, roofing materials, you're going to have releases of PAHs. Thing about many PAHs is they can travel long distances, and some of them are persistent and can bioaccumulate into the fatty tissues of organisms. I am particularly highlighting here the PAH naphthalene because this one tends to be associated with chemical pollution from fires. It's seen in smoke and in ash and in water, and it seems to be dominant across multiple in the literature when you look at different fires. Next slide. So just some information very specifically on naphthalene. Its commercial uses are in the manufacture of PVC plastics, moth repellents, and toilet deodorant blocks. It can come from burned tobacco and wood, coal tar, and petroleum distillation. And the primary exposure to humans is through inhalation or ingestion, so breathing or eating or drinking. It also can transfer to the fetus through the placenta and has been detected in breast milk. At high concentrations, it can cause hemolytic anemia, nausea, vomiting, diarrhea, blood in the urine, and jaundice, and is a possible carcinogen. So when it comes to PAHs, we see that wildfire smoke increases indoor and outdoor inhalation risks of PAHs. Indoor inhalation risk increases 3 times during wildfires and over 30 times higher in terms of outdoor inhalation risk. As already mentioned, many PAHs increase cancer risk, but as well as non-cancer risks, even over a short exposure period. We see cancer risks associated with a variety of PAHs listed here on this slide. Non-cancer hazard is largely driven by naphthalene, which was already presented. Okay, I am going to pass it on to my colleague now.
So there are many other chemicals that are associated with wildfire smoke. They can contain trace levels of many chemicals, including metals. We don't often think about heavy metals in our environment, with the exception of lead. We know that lead is an important environmental concern and health concern. But many heavy metals can harm human health. These can be mobilized from the burning of natural fuels, such as the vegetation, the grasses, or from the infrastructure, such as the cars or the buildings. But it's important to think about how these chemicals travel. They go into the atmosphere, they go into our waterways, we are exposed to them in many ways. And importantly, they're inhaled by people and animals. So there was an analysis of a decade of air quality data from the California wildfires. And they found that the chemicals in the air on smoke days contain higher levels of many of trace chemicals. And these can affect human health and ecosystem health. These included bromine, potassium, manganese, calcium. Some of them we think of as very good and healthy things. Copper, sodium, zinc. There also can be different chemical compositions between fires that burned minimal structures compared to those that burn many, such as in the campfire paradise in California. And the things that are burning are going to change the composition of what is potentially a contaminant. So in the campfires, there were higher concentrations of lead and copper compared to other fires. And also arsenic, chromium, and nickel were mobilized. There are other factors that explain different trace chemicals in fires that burn infrastructure. If we think about the prior uses of lead in older structures, lead can be remobilized from both natural and legacy sources. Burning along roadways, maybe we remobilize lead deposited before the phasing out of leaded gasoline, or also lead weights from car tires. And there also can be burning of structures with complex and diverse materials, including plastics, metals, and man-made components that are going to affect what we are potentially exposed to. There are also legacy contaminants that are specifically related to West Maui. There are agricultural lands, or former agricultural lands actually, in West Maui. Most of them are no longer have crops. They're well known for their legacy contaminants, including arsenic, which was used as a pesticide, and the organochlorine DDT. These are a major concern because if we think about the soil, these have been deposited into, once the vegetation is cleared, the rain events can potentially cause erosion and traveling of this highly contaminated, nutrient-rich sediment into waterways. And at the moment, we don't know, but we think it's possible that existing contamination could be mobilized by the wildfires. We don't have evidence of that quite yet, but hopefully there will be sampling. We're also going to move on to now a summary of the human health concerns from the wildfire smoke. There are many wildfire smoke health risks from the Maui fires. These fires were open air and of short duration. One thing to consider is that the geography and the high winds actually can be helpful. They can help disperse the toxic smoke. There aren't a lot of valleys or areas where the smoke can sort of hang around for a long time. So with this relatively short exposure period, the smoke, the thinking is that this could actually reduce the potential health risks from the smoke. But there are long-term health effects of chronic low-dose exposures to aldehydes, or actually we don't know the long-term health risks of chronic low-dose exposures to things like aldehydes, PAHs, and certain volatile organic compounds. So those are areas that need more research. There are definitely gaps in our knowledge at the moment. And we also would need measurements from the local areas of these sorts of things. One thing to consider is that delayed respiratory effects are possible. So there was a study in 2003 of Canadian wildfires. They found that there was a peak in respiratory consultations with the health provider 5 weeks after the fires, that feels like a long time. You know, we tend to think about having respiratory effects immediately after fires, but these delayed effects can be significant, especially on a strained healthcare system. There was a peak in hospital attendances for respiratory conditions and asthma a month after the 2002 wildfires in Lithuania. So there's been some consideration for administering steroids more readily than usual for asthmatics to sort of prevent respiratory incidents after the fact, or a delayed response to the fires. But at the moment, we don't know the effectiveness of that recommendation. We know that there are acute health concerns from wildfires. Often when people are exposed, they immediately have symptoms such as coughing and trouble breathing, stinging eyes, scratchy throats. We've talked about some of these, but also irritated sinuses and headaches are common, fatigue and a rapid heartbeat. And another thing to consider is that there are a range of health effects. There obviously can be everything from subclinical effects that you don't even notice the symptoms, even though you may have subclinical effects, something that isn't immediately measurable or noticed, all the way up to deaths in a wildfire situation. So sometimes it's hard to measure the total public health impact of a wildfire. I'm going to pass it back to Catherine.
Yes, and I'm going to apologize to my colleague. I passed the slides off to her too early and she handled it absolutely seamlessly. So thank you so much. So I'm going to talk a bit about toxic compounds in ash. Next slide. So what is ash? I think most of us instinctively know what it is. The picture you have here is of a National Guardsman after a fire in Washington State, and you can see all of the ash on the ground. I would argue that this person should definitely be wearing more protective gear, at least a mask, but it's a good visual image of what exactly is ash, especially after a wildfire. Essentially, ash is solid or particulate matter that remains after a fire. It's after something's burned, right? After vegetation or infrastructure or other things have been burned. It's typically deposited on the ground or on surfaces, and it contains charred organic compounds and mineral materials, among other compounds. Next slide. So ash is understudied with regard to human and ecological health impacts, as you probably deduced from the amount of information we provided on smoke. Smoke and wildfires are very well studied when it comes to human health, but surprisingly, ash is not. Yet a large portion of the chemical components mobilized by a fire in the ash. We see things like carbon and calcium and aluminum and iron commonly in ash, but also toxic compounds and even nutrients like magnesium and phosphorus. And it makes sense that they would be concentrated in ash if you think about it. If you have a bunch of treated 2x4s, right? You might have 2x4s that are treated with in order to prevent rot. And you have those in a structure, a fire burns them down. All of that wood is now concentrated in just a couple cups of ash. That means all of the toxins that were in relatively low doses on those big 2x4s are now concentrated in a very small amount of material. So the composition of ash depends on the types of elements and their concentrations in the environment. The materials burned, so structures and cars are going to have very different, lead to very different compositions in ash than, say, just the burning of vegetation. And other conditions such as the severity or intensity of the burn, as well as the duration, is going to have an impact on what's in that ash. Next slide. So once again, I'm bringing up this term of wildland-urban interface. So there's the complexity and total number of chemical components in an urban environment means that there's going to be more hazardous materials overall. And so ash toxicity especially will be especially elevated when fires are burn residential, commercial, and industrial infrastructure. We may see things like metals and metalloids like arsenic, chromium, cadmium, and lead, and all of these are toxic at relatively low doses. And I just really want to highlight here that lead is not safe at any level of exposure, and unfortunately, we see that lead is associated with fires involving human development. Next slide. And just very specifically, since we're talking about that wildland-urban interface, and once again highlighting that specific fires have specific concerns, Historic Lahaina is over 100 years old. Many of the buildings were constructed between mid-1800s and the 1980s. And those buildings are going to contain, for the most part, asbestos that might have been used in insulation, roof tiles, paints, and other materials. And it is well known that asbestos is carcinogenic. Lead was used in house paint until 1978. I think any of us who've had a home that was built prior to that date very much remember signing the form that says that you acknowledge that you may have lead in your house. It can be found in all sorts of household items, from tires to diving and fishing weights, batteries, electronics, and even antiques like leaded crystal. When things burn, all of this will burn, and that lead can be reintroduced into the environment, and it is a potent systemic poison. As I've said again, over and over again, there is no safe level of exposure to lead, and in particular, children are very vulnerable to harms from it. So I want to just give you a little bit more information about potential toxicity associated with ash. So in this slide, I'm actually going to start off with a study that looked at fires that did not include human development. So this is sort of your best case scenario. And this demonstrates that we still have toxic compounds in ash, even if we're not burning structures. So this is a really interesting study because it looked at wildland fires from 29 sites in 8 countries. And the results showed absolutely huge variation in the components of the ash, even when they were taken from the same ecosystems. So you may have had ash taken from 2 different sites in the same fire, and the results would be different. More severe fires had higher pH, generated ash with higher pH and more ash overall. Now, this presentation is not going to talk about the ecological impacts of wildfires. I do want to highlight one thing here, that ash with higher pH does pose a concern for marine environments because it can lower the pH of those aquatic environments. And this is very concerning for fish and other marine organisms. The largest concentrations of metals of concern seen across these sampling sites were manganese, zinc, and lead. And both manganese and lead have strong toxic potentials. They also, and I think this is important to highlight, there are no existing guidelines for determined thresholds of toxicity in ash. So folks have to use other standards, for example, standards that would apply to soil to determine whether or not levels of a compound exceed guidelines from state or federal organization entities. One thing that was seen is that when they did exceed any of the existing thresholds, it tended to be for lead. And we know once again, this was in sort of a best case scenario where they were looking at ash samples from fires in areas that were primarily unbuilt. And you do see toxic components, especially with metals and metalloids. We know that because there was the burning of structures and materials, that the ash in Lahaina will be much more toxic. Next slide. So I just have 2 more slides, kind of reiterating some research done on this, really to highlight the differences between ash that comes from fires without urban structures versus ones that do. This is a study that was conducted in a largely undeveloped part of Brazil. In 2020, they had a really bad fire season in some wetlands there. And they had samples of ash that they took in areas that were protected. So protected forest, protected river. So the sediment is the river areas. These are areas where there was very limited human development. When you look at PB, which is lead, Cu is copper, CD is cadmium, in those areas that were protected, the amount of metals, the concentrations of those metals is very low. If you look at what they call the degraded area, which is just an area that had human pollution and human development on it, you see that in that area, we have exceedances for lead, cadmium, and copper, and these are all metals of concern. Next slide. The authors of this study also did something very interesting. They also collected information on polycyclic aromatic hydrocarbons, those PAHs we've mentioned before, and they compared their findings with findings from ash in other places. And in areas where you had a strong wildland urban interface like California or South Korea, you see much higher levels of PAHs. And once again, some PAHs are carcinogenic, and as was the case in many of the studies that we've read, the naphthalene was the dominant PAH that was sampled. Next slide. So I'm just going to summarize some of the human health and environmental concerns from ash before we move on to the next section. So it's critical that the ash be cleaned from the affected areas. We know that ash contains toxic compounds, including heavy metals and PAHs. And these metal and chemical compounds can pollute water and land as well as people's homes and yards, and they present significant health risks. So the areas that are affected by ash need to be cleaned up properly and following established guidelines and protocols. Next slide. And this is going to be an important ongoing concern, as I think we're mostly well aware of, is that the search and recovery phase has largely ended. And so now the response is moving to removing toxic debris and ash stabilization. Ash in the environment is going to be a long-term concern, or medium to long-term concern for people and wildlife. It is particularly concerning from an ecological perspective if it gets into the fresh and marine waters, but it also can get into soil, it can be blown in the air, it can get in people's yards and houses. The long-term health effects are unknown to date. Okay.
So now I'm going to talk a little bit about the water contamination issues associated with wildfires. Drinking water is a huge concern. Safe drinking water is a huge concern after a wildfire. Wildfires affect the water quality by causing soil erosion, by increased flooding, and the flow of debris and potential contaminants into the water systems. There can be contamination of both municipal water systems and also private wells. And in particular, the issue is a loss of water pressure. For private wells, another issue is that they're often shallow, and so there can be direct runoff into private wells. And I don't know if some of you know, but Hawaii has an issue with cesspools. And so at the moment, we're not clear about the role of bacterial contamination from cesspools into private wells or other water systems. There can also be contamination of plumbing systems. There are some really prominent researchers from Purdue who are doing research on volatile organic compounds in water systems. At the moment, there is a unsafe water advisory issued by the Department of Health. The folks at Purdue have determined that the depressurization sometimes can cause plastic or backflow from the environment into the water system. In addition, there can be plastic thermal degradation, which means that the plastic decomposes because of the heat and the fire, and can basically release products like volatile organic compounds into the water and into the air around the water. In addition, there can be contaminated water back siphonage from the house into the lines. And so there's the water lines of a house, in particular a residential area that's affected by fire, need to be monitored really closely after a wildfire. And many things can contaminate the water after the fire. As we said, with the air, there can be contamination with heavy metals. There can be contamination with microbes, specifically in water. There also can be those volatile organic compounds. Benzene is one of them. These were first reported after the Tubbs fire in Santa Rosa, California in the 2017 fires. But they've also been reported after other fires, including those of Paradise, California. And one thing to think about is that this sort of contamination can last for a long time. Benzene, there have been very high benzene concentrations in the service line after the Camp Fire in Paradise, California. The thinking is that the water, for the most, is sometimes flowing through the line, but it's also sometimes just sitting in the line. And so as the water sits in the line, some of these compounds can desorb from the degraded plastics back into the water. And so much flushing and testing needs to happen to get the lines clean. So the California fire, there are 95 compounds identified in the service line, and those are described in this figure. But there were no contaminants detected at the water treatment plant. And so it really is a local effect from the heat and the destruction of the lines in the heat damaged area. So the damage to the drinking water system can be a very expensive and time-consuming issue to remediate. So I keep mentioning volatile organic compounds. There are many kinds of compounds that are volatile organic compounds. They can be both natural and man-made, and the key thing is that they volatilize at ambient environmental temperatures and pressure. Now, I keep talking about volatility, and what that is the ability of a compound to change its actual form from liquid form to a gaseous form. And organic compounds are defined as carbon-containing chemicals for the most part. So you've probably heard of many VOCs. You've probably heard of pesticide DDT, maybe chlordane. They also can come from plasticizers or fire retardants. Formaldehyde, acetone, propane, and butane are all VOCs. And obviously, we've been talking about benzene as a very important VOC as well. But other than benzene, which we know is a product of fire, we're not entirely clear which specific VOCs are of concern for human health. A little bit more about benzene. You see its cute little structure there. The natural sources of benzene include, it's basically a product of combustion. So volcanoes and forest fires. There are also human sources when you burn oil, gasoline, backyard fires, cigarette smoke. And it's also one of the main components of GP8, which is a jet propulsion fuel. It's derived from kerosene, and that's derived from kerosene, and JP8 also has other additives for military use. But most of the time, people are exposed to benzene through inhalation. For example, from the water that would occur when you're showering or bathing. We know that low-level exposure can cause eye and skin irritation, drowsiness, dizziness, and rapid heartbeat. Really tough to pinpoint things like headaches, nausea. Sometimes it can cause tremors and confusion and unconsciousness. It's really hard to trace those kinds of symptoms back to something like benzene exposure sometimes. But we also know that there can be higher levels of exposure that can result in all those low-level exposure symptoms, and additionally vomiting, seizures, irregular heartbeat, and ultimately it can result in coma and death. There's also very good evidence that benzene is a carcinogen. So next time you light candles in your household, just think about benzene. So what some of the research from the campfire in Paradise, California has found is that drinking water contamination with benzene, it might be less of a concern in standing structures. So these are structures that remained, that weren't burned in the fire. So the destroyed structures, you can see in this table at the bottom line, that 21% of the samples or the structures had were over the maximum contaminant level of benzene. Whereas when the service line that was sampled was a standing structure, only 1% were over the maximum contaminant level. So why is this important? We know that there can be serious acute illness from exposures to VOCs. And we also know that from our, there are vulnerable people and many people who are at risk and unable to get the care that they need. Or sometimes the symptoms are not necessarily going to point to a benzene exposure. There's also a lack of information on the composition of VOCs. You would have to do specific testing to know which ones you've been exposed to. So it's hard to speculate on which are the health concerns or communicate to affected communities or hospitals or medical providers about the symptoms that might be associated with exposures. And some semi-VOCs are persistent organic pollutants such as DDT, and they can last in the environment for a long time. And I'm not sure if you're familiar with the term bioaccumulate, but what that means is that they can be magnified through different species that move as you move up the food chain. And so because sometimes these semi-volatile compounds are lipophilic, which means they tend to partition into the fat. So as larger animals eat smaller animals, they can accumulate in the tissues. And so, of course, these are all enduring environmental health concerns for both the land and the water and for food systems. Another volatile organic compound is toluene. You may think of some of the uses of toluene in paints and paint thinners, fingernail polish, and lacquers. Sometimes they're also used in adhesives, rubbers, and printing and leather tanning processes. There's also a bit of toluene, 5 to 7% in gasoline and other fuels. And it's the largest source of atmospheric emissions and exposure by population. So humans are largely exposed to toluene through inhalation, but they can also be exposed via the dermal contact to skin, and you can also ingest toluene. As we mentioned, pregnancy is a particular time of vulnerability. And so what the literature has shown is that high chronic exposure during pregnancy can affect both prenatal and postnatal growth and development of the child. There can be a syndrome that resembles fetal alcohol syndrome associated with high chronic exposure during pregnancy. We mentioned some of the health effects of VOCs, eye, nose, and throat irritation, headaches. Ultimately, there can be damage to larger systems like liver, kidney, and the central nervous system. And these also can be carcinogenic. And some are suspected or known to cause cancer in humans, not just in the animal studies that were used to determine health effects. If you were to see or care for people who are experiencing things like dizziness and vomiting and fatigue, it might be useful to consider VOC exposure. I wanted to show you all some of the data from the water quality testing that is currently occurring in Maui. These are results from some of the very first tests from Lahaina and Upper Kula water systems. There are lots of caveats to these data. Some of them are from addresses specifically, some of them are also from hydrants. So as I mentioned before, sometimes it's the service lines from not at the plant, but at the home itself that is more relevant. And also the timing of the sampling is important to know whether water has stagnated in lines or not. But the good news is at the moment, the VOCs in the drinking water appear to be below allowable limits. I just wanted to point out there was of 27 samples, one sample in Lahaina was detectable at 0.7 parts per billion of benzene. If you notice over on the left there, the maximum contaminant limit of benzene is 5 ppb, so it's well below that. There were also some detectable samples of toluene and xylene. Those are both at less than 0.5 parts per billion in some of the Upper Kula samples, and those are well below the maximum contaminant levels of toluene and xylene.
And I think for the interest of time, maybe we'll skip these and move on to the next
I just want to point out one thing. Dioxins and furans are also products of burning, and TCDD is one type. It's the most toxic man-made substance and the 5th most toxic naturally occurring compound known to man. But what's interesting is that there was a global decline in dioxins for many years, and for the last 10 years or so, that has leveled off. And the thinking is that leveling off is due to potentially wildfire contributions. So now we'll move on to how to reduce exposures. I first want to point you to the Hawaii Department of Health website. This has been an excellent resource for all kinds of things, but including the health advisories on drinking water and smoke advisories and hazard advisories. They also have resources such as the Hawaii Poison Center. One thing I wanted to mention is that I created this slide about 2 days ago, and they have already changed their website from there, not just in colors, but some of the content as well. So it's worthwhile going back to check on a very regular basis what the latest information is. At the moment, there's a drinking water advisory for Lahaina and Upper Kula. You should avoid drinking any water from those areas. The tap water continues to be unsafe for drinking. You can see on the map there, the two bright orange areas are where the coverage of the unsafe water advisory. And you should only use bottled water for all drinking, brushing teeth, making ice, and preparing food to avoid potential exposures. One thing that's also important to notice is that there is no way, no filter, no any way to make the water safe at the moment. These are some of the prior advice that DOH was distributing before they knew anything about some of the levels, that you really just want to limit the temperature or the time in hot water to reduce VOC exposures. The water quality testing results are all publicly available from the Maui County websites. And you can find out the specific testing locations and the contaminants tested. There's also currently a smoke and dust advisory. The fire and smoke map from just a couple of days ago is shown on the right there. You can see there were maybe just a few fires still burning. But on the left there, you can see that they have deployed additional particulate sensors in Lahaina to monitor the air quality. And that's a map from today that you are seeing. And today the air quality is excellent. So there are many recommendations for how to reduce health effects from smoke and dust. You should avoid all outdoor activities. And you should try your best to stay indoors. And when you are indoors, you should close your windows and doors to keep outside air from coming in. An air conditioner or an air purifier with a HEPA filter can be important for cleaning the air. But one thing that the Department of Health also recommends is that you should keep all of your medications readily on hand. And you should take your medications on schedule as they've been prescribed. Another thing that's important is that if you do experience any health effects that are unusual for you, you should contact your doctor and tell them that you were affected by the fires. Because we want to reduce any exposures from any burning sources and reduce respiratory issues, you are strongly advised not to smoke and to avoid secondhand smoke. And again, dehydration is an important issue. These fires they can be hot and they can dehydrate you. And so especially if you're going into the area and you have to bring your own bottled water, make sure you bring and drink plenty of water. There's also a hazard advisory if you have to return to the impacted area. For the most part, residents are asked to avoid the area at the moment until search and recovery efforts are completed, until hazard materials are removed, ashes removed. Really, they want you to avoid the area. There are unstable structures. There's all sorts of hazards. There's debris and toxic contaminants, as we have discussed today. So it's just best to avoid the area. And absolutely, children and pregnant people should not help with the cleanup efforts. If you absolutely must enter the area, there are things you can do to help protect yourself. There's personal protective equipment. That man over there is actually that's from an occupational handbook. So you're not expected to wear all the vest and the hard hat and all that, but the Department of Health recommends you wear a protective face mask. That would be specifically an N95 type mask, goggles, gloves, long sleeves, pants, socks, and shoes. And all of this is to keep your skin from touching the ash and the potential contaminants in the ash. That mask in particular is important. It's not any average mask that is sufficient. N95 or NIOSH or maybe a KN95 is more protective than a typical mask or just a regular medical mask. It's important to take all these medical precautions and important to seek medical assistance if you don't feel well after exposure. I also want to point out that the Department of Health has provided a hazard advisory fact sheet. There's a QR code for that. It's available in several languages to get the word out about potential hazards in the fire area. Lastly, I want to point you to some resources. The Centers for Disease Control and Prevention has a really fabulous website on air quality and wildfire smoke specifically. There's guidance for health professionals that is very useful. And the United States Environmental Protection Agency also has a toolbox for wildfires, what you should do regarding smoke and health and current fires. And there's also this guide produced by the California Air Resources Board and the California Department of Public Health about wildfire smoke in particular for public health professionals that addresses health issues and environmental health issues of wildfires. So in summary, I wanted to recap our learning objectives and what we hope you have taken away from our talk today. So in terms of routes of exposure to contaminants from wildfires, we discussed inhalation, ingestion, and dermal contact, and that there are vulnerable populations to the environmental health impacts, including pregnant women, children, older adults, low income, those with pre-existing conditions, and firefighters. Also, the chemical and metal contaminants of concern are varied and can be different in different fires, but include smoke, ash, particulate matter, VOCs, ozone, carbon monoxide, heavy metals, PHs, aldehydes, dioxins. There can be more, of course, this is not an exhaustive list. And that the potential health effects of these contaminants include carcinogenic, cancer-causing health effects and non-carcinogenic concerns, such as respiratory, pulmonary, neurological, developmental, and reproductive health effects. And lastly, we want to leave you with the tips for reducing exposure. We want to ask you to refer to the Hawaii Department of Health advisories for the latest information for particular areas concerning the Maui wildfires. We also, that concludes our talk. We want to thank you for attending today's presentation. And in particular, we'd like to thank the following organizations and individuals for their support: the Hawaii Public Health Institute, the US EPA, the Hawaii Department of Health, and colleague Leslie M. Quiros-Alcala of Johns Hopkins University. We now open it up for questions. Oh,
I'm over here talking stories to myself, and I realized I was on mute. I just wanted to say echo and say mahalo to the two of you for such a wonderful presentation, and just echoing the the comment in here, an excellent summary and discussion. I have a couple questions that had kind of been filtering in throughout the presentation that I want to drop it off to the. Let me go Brady Bunch style. Okay. How long is the normal time for these pollutants to stay in the air in those affected areas?
That is an interesting question. I don't know that there is a normal. And that it's not an easy answer, because there are so many things that can affect how long chemicals hang around. The chemical properties themselves, as I mentioned, some of them are persistent, which means that they stay for a very long time. Some of them are elemental, which means they're just, the heavy metals are elements. They're not going to degrade into anything further. So there's no quick and easy answer for that, unfortunately. Catherine, do you want to add anything? Uh-oh, did I freeze?
Yeah, I think she froze. Oh no. You can hear me, right? Okay, maybe I think she might have froze. Okay. Hopefully we'll give it some time to see if she can bounce back on. Again. Oh shucks. Okay. Maybe. Well, I think maybe she's just glitching now, and then we'll come back and wait for her to come back. Next question was. Oh,
she's back.
Oh, you're back.
I'm back. Okay, you can hear me now. Sorry about that.
Yeah.
Believe it or not, I'm in my office at work. So the meteorological, if you're talking about smoke specifically, the meteorological conditions can have a big impact on that as well. So we mentioned that at the beginning. If you're in a valley that doesn't have a lot of circulation of air, that's going to be very different, or in a basin versus if you're in an area where you have heavy trade winds. So that's one thing. The other part that was brought up was about the type specifically of contaminants and certain ones being persistent. I know one concern on the environmental end is whether or not some of these contaminants are going to end up in fish and seafood. And that's to be seen, but this can be one way in which contamination can endure an environment for a very long time.
Thank you. Next question we received, if we remove ash as much as possible and then cover the whole area with heavier, healthy compost and soil, how long do you believe it will take for biological compounds to break it all down? What is the estimate for most toxic pollutants?
I think what I'm going to say here is that neither of us are soil scientists. So I don't want to speculate on anything along those lines. I think what we can do is take note of the question and maybe send it around our networks to see if somebody might have a better response.
Awesome, thank you. Yeah, I'll make sure to do that. Let's see. Sorry, next question. Can you speak to groundwater contaminant concern? I know you kind of breezed through that question, that area, that topic a little bit, but can you speak to groundwater contaminant concerns, dioxins, PCBs, etc.? Did we skip past that?
I don't believe they are currently testing. I don't know. I don't want to speculate, but I don't know if they are currently testing for dioxins and PCBs in the groundwater. Those happen to be both persistent and bioaccumulative compounds. They don't usually partition into the water. They actually those two particularly tend to settle in the sediment. So I don't know enough about them in the groundwater.
Thank you. Somebody else had posed this question, and this is your for your opinion, but should the communities be concerned that DOE plans to reopen Lahaina schools after fall break? And I guess this was per the DOE meeting yesterday. Amongst those concerns were mentioned environmental health hazards, especially to those who would be exposed. And of course, there's a concern for the re-traumatization for schools, but should communities be, I think maybe the idea is like, should communities be concerned if they're promoting return to school in Lahaina?
I don't know how to answer that, honestly. I would really hope that there is substantial testing of the water, air, soil surrounding the schools to ensure their safety. I had heard through the grapevine that they were working, that Department of Health and DOE were working together on that sort of testing, but I don't know the details of what is happening. Do you know, Catherine?
I don't know the details. I would fully agree with you about wanting, to make sure that that testing and monitoring was happening. The other thing I would add, though, is with, there are many people are bigger than just one thing, right? So there's environmental health concerns, but there are other ways in which we make decisions, and there's other things that also can have impacts on our health. And so I think that it's critical that the community is informed of those risks, but that people are able to balance whether or not, it's more important to have a small amount of environmental risk, but for their kids to go back to school, for their kids to have those social networks, for the families to have those social networks. So I also feel like I'm not particularly comfortable to answer that question, not fully knowing what's being done, but do want to highlight the importance of people being able to be fully informed, but to make their own decisions about what's right for them and their families.
Thank you. I know that was a kind of like a tricky question. So we had another person asked, what can volunteers do to help those who live around the area?
I think it depends a little bit about your expertise. I do think mental health is needed. Mental health counselors are needed in the area. I know that the Department of Health has a sign up. If you are interested in providing those types of services, you can sign up on that website that I showed. I don't know how. So sometimes there are calls for volunteers to help with FEMA's efforts to sign people up for benefits. So sometimes you'll see a call for that sort of volunteer. And I did read just in the newspaper that, even some tourists who are coming to Maui sometimes will volunteer a day of their stay to help with those sorts of efforts. There are always donations being collected. I don't know about on the ground volunteering though.
Thank you. I think that's great. I think a lot of folks can help in the mental health arena, and if they, or just even to listen. I know that there's those folks who are dealing with during their grief process. I think just even a listening ear could be really beneficial to the communities around that area. A couple more questions because then we're kind of running
I was
out.
going to add one tiny thing to that, just as we are going through this. And, one of the things we said over and over and over is that pregnant women and children should not be going into those areas. So if a family really feels that they absolutely need to go in to the burnt areas, and obviously it's really not good if children and pregnant women are there, babysitting support.
A couple more questions there because I know we're just kind of getting on time. Where did I lose it? Okay, this is in English, but it's scientific. Are there any hexavalent chromium sources in burn areas of Kula or West Maui? Is there anyone, to your knowledge, is anyone testing for chromium carcinogens like lead chromates, or is this necessary?
So I've seen a few different research groups who are starting some studies, and I don't know the details of what specifically they plan to test for. I do know that for every chemical that you test for adds a couple $100 to the cost of each sample. So there's always a weighing of more samples for fewer compounds, testing for fewer compounds, or more compounds and testing fewer samples. And so I just wanted to put that out there, that both in environmental testing and human biomonitoring are very expensive. So as much as we would like to do these sorts of studies, they can be cost prohibitive sometimes.
Okay. We had another question come in. To your knowledge, what is the estimated, or like your best guess of an estimated length of time for the Lahaina community to even have the potential to rebuild? Do all environmental concerns need to be cleaned up and addressed prior to building permits being issued?
That actually sounds like a question for more governmental agencies. I think that's pretty well out of our hands to speculate on.
Okay. Okay, next question. Maybe we'll go two more. Do any of these pollutants bioacclimate? Accumulate. My apologies. Is there or should there be a concern about exposure through ingesting limu or fish or other food crops?
These compounds absolutely bioaccumulate. We mentioned several dioxins and DDT, and
The
many
metals,
of them,
various metals.
metals can be amplified in the food chain. Absolutely. Yes.
And I know that there is a lot of work actually looking at that. So there are a number of people quite interested across agencies, university, community groups, specifically in about the possibility of contamination of the food web. We do know full well that numbers of fish, generally fish are quite susceptible to environmental contamination. So yes, this is a very real concern, and it would be, from my professional opinion, one of the areas in which we need to monitor quite carefully. Specifically, you asked about limu, in addition to fish. So certain types of algae do accumulate contaminants more than others, especially your bigger red algae. I believe limu is a little less sensitive to it, but yes, all of them across the board would be a concern until monitoring is better conducted.
Thank you. Okay, that kind of rounds up our time. I want to respect everyone's time who was, who jumped on the call. For those that had questions that weren't, that I didn't get to, I am collecting them and sharing them with our speakers after this training. So that way folks, if there's an opportunity for them to answer, I'm going to make sure that we have enough time and that we can verify sources and then coming back. So much kudos to the two of you. I'm hearing it in the chat. Okay, and then some folks are asking about CEs. So again, thank you for everyone who jumped on. I will be sending a mahalo email with the evaluation shortly after this, as well as the presenter slides. I wanted to check in if that would be okay, if the two of you would PDF those slides over for me so I could share it over to folks. And thank you again for the two of you for spending the time and informing our audience members. Take care, everybody. Be safe, be well. Malama pono, and hopefully you all have a great holiday weekend coming up.
Thank
Mahalo.
you. Thank you for having us.